Welcome back, everybody, to another episode or another Epidose of These Crazy People Just Eat Meat and Can't Stop Talking About It. Today, I've got the full Meathead ensemble on board, and today's topic is something near and dear to everybody's heart and probably very important to this group in particular, mental health. Anyways, everybody out there is trying not to go crazy with being sequestered in their houses because of this crazy virus that's supposedly rampaging the planet, and food prices are going up. People are losing their jobs. People are losing their houses. And we're here to talk about how we've seen change in diet and eating differently make a profound impact on people's lives. So probably first and foremost comes to mind Emily's story. Emily, you want to give them a quick dip into your improvements?
Yes. So in February of 2019, I was on I was on 900 milligrams of lithium, 80 milligrams of Prozac, and I was taking up to 80 milligrams of Adderall every day just to get out of bed. Much less, also because of the Adderall, I would have to have a sleep med to go to sleep at night. And I was not functioning. I was not working. And I had to move in with my mom, and I was just miserable. And then I started eating 50% animal meat and 50% animal fat. And by April, the end of April of 2019 was the last time I had a manic or depressive episode. And for me, manic and depressive episode was for like a significant. It wasn't just like a mood up and down. It was like it knocked me out. Like I was in bed, I couldn't get out of bed if I had a depressive episode. Or manic episodes were like whenever I would stay up for a long time and I would be like hyper focused on something. And then I was just imbalanced. And so then in September of this year of 2019, my psychiatrist effectively tapered me off of all of my medications over from July to September. And so I had my last dose in the end of September, and I have stayed out of the psych ward, which is a huge accomplishment. And it's not even something that I had to effort myself to do. The only effort I had to do was to maintain eating meat and eating fat. Everything else just fell into place, and I was stable. And I kept that stability even through life circumstances, horrible life circumstances. I've been able to maintain stability and functioning. I've been working full time ever since June of 2019, and getting out of bed every morning when the sun comes in my window, which if you're familiar with depression, that usually doesn't happen. And so I have been so blessed to be able to see that reproduce in some of the clients that I've worked with as well, and watch them to crawl out of that pit of mental illness hell, just by eating animal meat and animal fat. And it's been a really, really, really cool experience. And I never knew that I could even function. I had no clue. I thought that you just got worse and worse and worse. I didn't know I could ever get better. You're muted, Tom.
Yeah, who else wants to throw in with that? Justin, did you have something to say?
Yeah, so I mean, mental health, as being a mental health clinician, as well as suffering from mental health myself, I had bad anxiety and pretty gnarly depressive episodes, even going through like my bachelor's in grad school. And it definitely started during my teenage years. And then when I had the migraines in my early 20s, like, I think what Emily talks about is that like you're depressed, then you have some other stuff going on, and so that you're not functional, then you get depressed because you're not functional, and then that just becomes cyclical. I was often on a few medications, so trazodone, Celexa, Wellbutrin, which is pretty standard. I would take them for like a year, and then people said like, I seemed weird when I was on them, like not myself. So then I would go off. I was dabbling in other illicit substances, drugs that are not prescribed by a doctor, as well. So, I mean, that probably didn't help, but, that was just me and partying and stuff like that. So, yeah, I mean, I would have times where like I wouldn't want to get out of bed. Everything just felt hard. I feel like that's like a really easy way to put it, is like easy stuff feels hard. Going to school feels hard. Talking to people feels hard. Just everything just feels like this pressure, like more difficult. And with carnivore, it's not that everything is easy, but just not everything is hard. And that may sound like it feels like life is as difficult as it should be, that the difficulty hasn't been ramped up. Whereas when you're suffering with depression and anxiety, I mean, in high school, my anxiety was so bad, which I didn't know what it was. That's what's also terrible, is when you're a kid and when you're, a teenager, you oftentimes don't know what's going on because you think everyone's just weird, or you're the weirdest one of the weird. So that's why you feel weird, And so my anxiety used to be so bad that if I was walking on a street and someone was walking on the same street coming towards me, I would have to cross the street because I couldn't, it would make me too anxious to cross
Face
them.
them.
Yeah, to face them. Yeah, on the same side of the street. It was really weird. So I had some really bad anxiety. Going to work, I would have like panic attacks of going to work to like face the crowd or face people and stuff like that because, when you're young, 17, 18, all you can get is low-level jobs at like a big box store or something like that anyway. And so those jobs, to me, they're really stressful. Like, don't put me at a cashier. Don't put me like in front of customers, don't, because that stuff gives me way too much anxiety. I still don't think I could do it now. Like cashier, I feel like it would still make my anxiety too bad. Or an example I like is if anyone's ever been to a fast food restaurant where it's usually the manager, they'll have that headset thing and they'll be taking your order and listening to an order on the headset. Like that is like no way. Like there's no way I could do that. I would like mess it up or be so scared of messing it up, And so there's still some limitations and I get that. And I found my niche, what I'm good at, but yeah, I felt so weird, like, throwing up in the toilet, like Eminem style before going to work because my anxiety is so bad. Yeah. Once I got there and settled in, I could usually adjust, but it was just like the anxiety of going in. So say I had a shift at 9 a.m, I wouldn't be able to sleep because I'd be so anxious through the night and then trying to go and, then the migraines and stuff like that didn't help. And then the being depressed for feeling that way, and just this mild to moderate depression all day, every day with the occasional suicidality, or ideation. Like that was most of my days, most of my weeks, most of my years, and then of course PTSD from childhood stuff, PTSD from car accidents. I think so. After my first car accident last year is when I started Carnivore, was within about a month or so after that. And I feel like Carnivore slows things down enough to where at least now I can identify, oh, I'm anxious. Oh, here's this emotion. Or I'm sitting in traffic. I'm being hyper vigilant because of the post-traumatic stress due to the car accident. So I'm looking in the mirror 5 or 6 times, but at least I know I'm looking in the mirror 5 or 6 times and why I'm doing it. And it's just not an unconscious, automatic process. And I feel like that's what Carnivore does, is it illuminates to where you can choose or you know what's going on. It gives you more insight.
Well, it certainly lowers the intensity, right? Yeah. Anybody else? Joe, Ray, when you guys want to chime in?
Yeah, I was just going to say, for me, I mean, being a chef, it's a very high stress industry. For many years, you'd go into work never happy. You didn't want to go into work. Then you had to deal with all the nonsense at work as well. And I guess, you've got access to lots of sweets as well. So that doesn't really help either. So, you're feeling down, you want to go to the cool room and grab a piece of chocolate cake and you eat it, and you're great for 10 minutes, half an hour, and then all of a sudden you crash. So, I mean, I went and saw a doctor many years ago, and they wanted to prescribe me medication, and I refused to take any. And I used exercise as my outlet, going out on the bike, going for a ride, and enjoying the sunshine, enjoying the day. So that's how I sort of was able to navigate through that. Then got onto keto. Was introduced to keto back in January 2017, and that's when it really improved. Was by cutting out all the sugars, and now carnivore, things are definitely much better. If I do have an episode, it's not 2-3 weeks. It might be a couple of days, and that's it. But I'm more aware of what's going on, so it's definitely better.
Ray, you want to take a swing?
Yeah, for me, so I didn't realize I had anxiety until I was carnivore. So I remember some nights I couldn't sleep because I was always afraid that my door would get busted in by whatever, whether it was cops or robbers or whatever. I was like super paranoid.
Wow.
I've actually slept with my piece under my pillow before. And I live in a very safe neighborhood. I mean, really safe. So, but for some reason I was always fearful for these things. I don't know, it was a habit that I formed for some reason. I don't know why. But I literally couldn't sleep sometimes because of it, So, but I didn't know what that was. I guess that must have been anxiety. The way I realized it is when I was carnivore, I stopped doing any of that.
Wow.
I would lie my head down on the pillow and then just gone like within 5 minutes. So those thoughts would not rampage in my mind, like it did before. I'd have to check every door every time. So I was kind of almost compulsive about that kind of stuff. Now, many times the doors are unlocked, garage doors open. And, I actually don't care. Before, man, I'd freak out. So, I'd yell at my wife. I'm like, you can't do this, that kind of stuff. Now it's like, it was open. So, yeah, that was probably the biggest realization is I had no idea that I had mental issues, but apparently I did. Not just that, I also had mood issues too, real bad. So when I'd first wake up, I'd be like grumpy. But I thought that, all of these reactions, I really thought, oh, everybody's got them. This is totally normal. It's not just me, right? Not just me that's paranoid about locking things up and, trying to protect the home or waking up grumpy. Oh, everybody does it. So I didn't think nothing of it until I was carnivore. And I woke up and I was springing my step, and no problems at all. So I was like, oh my God, all that time I just seemed like I've had issues.
Yeah, when you get to the other side, you realize things like anxiety are heavily influencing all your decisions in the past. And then when it subsides, you're almost a different person because you're making different choices and you feel so different all the time. So you behave different. So yeah, for sure. Well, I have a video clip I want to play. It's from Human Performance Outliers with Zach Bitter and Dr. Shawn Baker, and they're talking to one of my favorite subjects, Dr. Chris Palmer. And so I got a little segment here I got queued up that I'm going to play for everybody. and hopefully the sound quality is all right. And hopefully there's, we're going to talk about it afterward, do a little commentary. So, but if there's some really weird editing in this final video, you know that this clip didn't work out for one reason or another. So let me click a few things, get it queued up. All right, could you guys see it?
Yes.
All right.
So for a long time, people kept saying that. And then, you know, especially with all of the antidepressants and mood stabilizers and anti-anxiety medicines and everything else that pharmaceutical companies are putting out, a lot of people thought, oh, these are all artifacts of the pharmaceutical companies. They're just pushing pills. They just want to sell their pills, and they put ads on TV to, you suffer from this. Oh, ask your doctor if this pill is right for you. And, you know, and you're supposed to go and take a pill. And of course, they're making out like bandits. It's a multi-billion-dollar business. And so a lot of people thought, you know, it's just all driven by the pharmaceutical companies. And then other people, you know, think, well, you know, demise of society sucks. Everybody's on their cell phone. People know more about interacting with each other on their cell phone than they do like looking each other in the eye and actually having a conversation. Everybody's busy, everybody's stressed, you know, work. Everybody's working all the time because we've got our cell phones. We're on, you know, emails 24/7. We're on, if you're trying to like run a podcast series or something, you're probably on social media a lot. And you're like, then you got all these people trashing you on, and you got to deal with all that shit. And, you know, you got all these people like calling you names and all that stuff. And so maybe that's the reason everybody's all depressed and anxious and stuff is because of society. But in the last 20 years, we now have really good evidence. And we have good evidence because the same people who did the studies 20 years ago redid them. And they went door to door to people's houses. They didn't look at mental health clinics. They didn't look at primary care office. They went door to door. And they asked people all these detailed questions about, do you have an anxiety disorder? Do you have depression? Have you been suicidal? Have you tried to kill yourself? All these kind of questions. And what we now know is that we have an epidemic of mental disorders in society. So anxiety disorders are up, it's about 30% in adults. If you talk to any teacher, whether it's at the elementary school level, the high school level, or the college level, they are beside themselves. The young generation is like seeing ridiculous, out of control levels of anxiety disorders, depression, hurting themselves, trying to kill themselves, but sometimes not trying to kill themselves, just cutting themselves to kind of release their anguish. I mean, they're doing all sorts of stuff. And the educators, like especially the ones who've been around a while, they're like, something's going on here. This is not normal. Something is really messed up. When we look at depression, major depression is now the leading cause of disability in the world. There are more people, and definitely in the United States. So there are more people who are unable to go to work and pay taxes because of major depression than there are people who are unable to go to work because they have cancer or because they had a stroke or because they had a heart attack or anything else. So major depression is now the leading cause of disability. The latest statistic was about 13%. 13% of the United States population is currently taking an antidepressant. When we look at the mental disorders that everybody assumes are genetic, or they're like, these are like the real disorders. There's no, you know, these aren't anxiety, depression. And again, those are the wimpy people. Those are the complainers. Everybody's just complaining. When we look at the hardcore unequivocal diagnoses. Autism. So autism is up 300% in about 15 years. And when we look at bipolar disorder, it's shocking. So with bipolar disorder, the rates in the last 15 years have doubled in adults, but among kids and adolescents, the rates have gone up 4,000%. It's a 40-fold increase. And just in that statistic was just 10 years. And a lot of people are like, oh, but you're overdiagnosing everybody. It's all the pharmaceutical companies. It's, you know, so here's the real kind of litmus test. Suicide. What about suicide? Because that's not black and that's not like gray. That's black and white. That's like, if you off yourself, like there's something wrong.
There's no mild depression then.
We can't be equivocal about suicide rates. And suicide rates over the last 15 years are up 30% across the board. But if we look at a bigger measure of people dying by their own hand, and so there's this statistic that people call deaths of despair. And it includes people who commit suicide, but it also includes people who die of overdoses. So they die of an opioid overdose, or they die of alcohol poisoning, or something else. So those deaths are up 100% over the last 15 years. So the rates have doubled of deaths of despair. And again, those aren't an overdiagnosis. Those aren't just somebody whiny complaining. I mean, maybe they're whiny complaining while they're offing themselves, but like, you know, I think they're pretty serious when they go take their own life. And so we have these epidemics in society, and most people again are blaming the things that I mentioned. They're blaming, oh, well, society, everybody's got a cell phone, or, you know, pharmaceutical companies, those evil villains are out to just sell everyone pills, but I can't help but notice that, oh, gee, if we look at the population of the world, is there anything else going on? Any other epidemics happening at the same time, at the exact same time? Oh, gee, wait, look, obesity rates are skyrocketing. Obesity is oh, and what about diabetes? Oh my God, that's skyrocketing too. I mean, the latest statistics are almost, you know, anywhere from 35 to 50% of the United States population is either pre-diabetic or diabetic. And I actually am one to say, I don't think it's a coincidence at all. I think mental disorders are in fact skyrocketing because I think they're directly linked to all of those metabolic problems.
Yeah, I mean, I wouldn't disagree with you at all. I mean, it's truly shocking to me, the statistics you're putting out there. I mean, I knew it was bad, but I mean, that really just sort of kind of really drives the nail home a little bit. But, you know, and this is interesting, you know, because as you probably know, I kind of been an advocate of a kind of an unusual diet where people are just basically eating a meat-based diet. But what I am seeing, one of the more common things I'm seeing, and obviously that has a profound effect on metabolism, is that there is a very high number of people that do seem to resolve mood disorders. I mean, I've seen anxiety, I've seen depression, I've seen bipolar disorder, I've seen people with, you know, even you know, not necessarily autism being cured, but some of the perseverations and some of the problems, thought problems that manifest themselves during autism. I mean, I have an autistic son, so I'm very acutely aware of that particular one. So I'm seeing just, you know, even like things, post-traumatic stress disorder. I mean, I'm seeing these things all improve by changing diet. I mean, I'm just wondering if you have a similar experience. And what does you know, your preliminary work in this sort of indicate? What things are potentially amenable to diet, and what things may not be when it comes to mental health disorders?
Yeah, so great questions. So, you know, that's I'm seeing it too. So so this work for me kind of, it started, you know, 20 years ago. I was on a low carb diet 20 years ago, and you know, that at that time it was called the Atkins diet. There were tons of people who kind of, even in the Atkins diet movement, there were tons of people who were carnivore. A lot of people kind of knew if you really want to lose weight, if you really want to get ripped, if you really want to whatever, eat no carbs, not just low carb, eat no carb. And what is no carb? That's carnivore. That is, eat a lot of meat and fish and poultry and eggs and maybe some cheese, but you still got to limit dairy. You can't have too much, and you don't really have nuts. You don't have fruits or vegetables. You don't have anything else. And so that's kind of the definition of carnivore. So I mean, it's been around for a while. So I definitely noticed dramatic effects on myself. I started it because I had all of the signs of metabolic syndrome. My blood pressure was up. My bad cholesterol was bad. My good cholesterol was bad. My triglycerides were through the roof. Like everything was bad. And I'd been on a low fat diet. I was pretty disciplined on my low fat diet. I was eating like almost no fat sometimes. I'd get like 2 or 3 grams of fat a day. Why? Because the doctors were telling me that's what you got to do. That if you want to take care of yourself, eat a low fat diet. And I was exercising pretty regularly, and so I did that. And push came to shove after several years of that, and the doctor's like, okay, Chris, you got to go on meds. And I was like, well, I'm going to do this one radical thing, like just on an off chance that it might help, because I've heard through the grapevine these crazy people doing this Atkins diet, and somehow they were eating eggs every morning. And at that point, eggs were vilified still. Like eggs, they're bad for your cholesterol. They're bad for everything. So don't eat any eggs. And I'm like, okay, screw it. I'm gonna try it, see what happens. And so I go ahead and do the Atkins diet, which at the time was ketogenic for me as well. I definitely went through phases where I was eating no carbs, so I was pretty much carnivore. And it absolutely, within 3 months, all my numbers got better. My blood pressure was coming down. All my metabolic abnormalities were corrected. The doctor's like, oh my God, whatever you're doing, it's awesome. Keep it up. But one of the things that I noticed just personally is that I felt a lot better. I had more energy. I had more motivation. And it wasn't like I was clinically depressed at the time. It wasn't that I had just finished medical school. I was doing my internship and residency. I was pretty hardworking, pretty disciplined. But it was work. Like all of it was work. Like I'd come home at the end of the day and I'd lay on the couch and I'd fall asleep while I'm watching TV and having my low fat treats. So that started to change for me. I started getting this energy where I'm like, I'm gonna go out for a run just for fun of it. Like, and that would have never happened before. Like, why would I run for fun? There are all these people who are like, work hard, play hard. And I would always look at them like, why the hell do you want to play hard? Like, isn't life hard enough already? Like, we're working our asses off. We're like so tired. We're exhausted all the time. Who the hell wants to play hard? I want to play by laying on a beach and sleeping and eating something. It's like, that's my idea of playing. Well, somehow I turned into this person who's like this work hard, play hard kind of person. And so like I exercise for fun. I really don't want to go without exercise for more than a day or two because I just feel like shit. I'm like, I got to get my energy out. I got to do something. And so I started using this diet in people who had treatment resistant depression maybe 15 years ago. And I was definitely finding, there were a few cases that were really striking that it was, they had tried everything, including shock therapy, 30 different medications, all sorts of psychotherapy, hospitalization, like all sorts of stuff. They tried everything and nothing was working for them. And I saw several of them get better with this low carb keto diet. At that point, I really wasn't willing to like come out of the woodwork. I had my good gig at Harvard, and I was pretty conservative. Atkins diet, low carb, keto, that's all quackery. I didn't want to go out on a limb and like risk everything and do anything. And then that all changed like 3.5 years ago. So one of my patients that I had known for a long time, schizophrenia. He had tried everything. He was on tons of medicine. He was disabled by his illness. So, and he was schizophrenic. If anybody has ever known anybody with schizophrenia, it's a pretty debilitating illness. People are hallucinating, they're hearing voices, they're delusional, they think everybody's after them, they have trouble going out into public, they definitely have trouble interacting with people, they're almost always unemployed, most of them are. And I don't mean to be disparaging in that way. And for those who have schizophrenia and can work, all the power to them. I'm not trying to put you down, but most people are really disabled by their illness, and they're suffering all the time, every day. A lot of people with schizophrenia end up killing themselves. Some studies find that like 40 to 50% of them will at least try to kill themselves at least once, because they're that miserable. I mean, they're just miserable. And so this guy wanted to lose some weight, and so I put him on the keto diet, and lo and behold, over the next 3 months, there was like this radical transformation in him, something that I had never seen in the 10 years I'd been treating him. And we had tried lots of medicines, lots of different treatments, nothing else had worked. And he started coming to life. But equally importantly, he was like just spontaneously letting me know my hallucinations are kind of going away. Those paranoid delusions that I've been having for years, they're going away. Like something's happening to me, and I'm getting a lot better.
All right, so
Wow.
some pretty compelling video there. One of my favorite podcasts of all time, for sure. A little bit lengthy, perhaps. So, what do you guys say?
It's undeniable. It's amazing to have somebody who is hopeless, and not seeing any way out. And even with schizophrenia, the medical model doesn't have any way out for them. I mean, they have no answers, but there is a complete turnaround with food. That's amazing.
Yeah, especially with schizophrenia, So, in other interviews, Dr. Palmer talked about how the typical medications they put people on make their metabolic readings worse. It puts weight on people. It creates eating disorders. It can create sleeping disorders, and so on and so forth. So being able to dial somebody's medication back, even if they're not completely cured, could be life extending. Like you said, people, particularly like schizophrenics, they usually lose about 25% of their years compared to everybody else. They live a life that's 20, 25 years shorter than everyone else.
Yeah.
So anyway, I think we all probably saw a little bit of our own experience of what he was talking about there, right?
I
thought it was interesting.
Back up. Oh, go ahead, Joe.
I was going to say, I thought it was interesting, all the statistics. It's quite bad, isn't it? It's quite alarming that,
I have no idea what's that bad.
Yeah, I mean, it's
wow,
not good at all.
Yeah.
So yeah, and speaking of statistics, so I just looked up the diabetes statistics that just came out from 2008 to 2018. So we have 34.2 million Americans, just over 1 in 10 have diabetes. 88 million American adults, approximately 1 in 3, have pre-diabetes. New diabetes cases are higher among non-Hispanic Blacks and people of Hispanic origin than non-Hispanic Asians and non-Hispanic whites. For adults diagnosed with diabetes, they say that new cases actually did decrease from 2008 through 2018. So maybe this whole keto movement, carnivore movement is doing, maybe that's to credit for that dent. 15% were smokers, 89% were overweight, and 38% were physically inactive. 37% had chronic kidney disease, stage 1 through 4, and fewer than 25% with moderate to severe chronic kidney disease. So among the youth, though, there's a high incidence of increased diagnosis of diabetes among the youth. For ages 10 to 19 years, incidence of type 2 diabetes remains stable, I guess, from 2008 to 2018, which still isn't great. But, you know, when you're an adult, kids don't usually get into keto and stuff. That's usually, you know, when you're an adult after you've already wrecked your body. And the current suicide rate in the USA for adults, it says the male rate is 23.6, and we're ranked 27th in suicide. I want to say that's in the millions. I forgot to look up. Oh, per 100,000 people. So 23.8 per 100,000. Yeah, so that's where we're at. So it's pretty close.
That's suicide, right?
Yes.
Wow.
Per 100,000, 23.6. That's just the male. The female is 7.2, but women tend to make more attempts, and men seem to be more successful at it. So there you go, men. We're better than women at something, taking ourselves out.
We go to hard way.
But yeah, and so some of this, so we think about, you know, what he brought up about, okay, you're depressed, so you don't really want to take good care of yourself, so you're gaining weight. And, you know, like Fat Bastard from Austin Powers, if you guys remember the movie, I eat because I'm depressed. I'm depressed because I eat, you know, and that
in
really,
my belly.
Get in my belly. Bacon back ribs. Am I doing an Irish accent? I feel like I'm just yelling. Like, no, right? I'm just yelling. Just want to make sure it comes out.
Wasn't he Scottish?
Scottish, yes. I just offended another whole section of people. At least I'm not saying our friend from Switzerland is Swedish. I've stopped doing that. So that's a plus. Just a shout out. You know who you are. Anyway.
Well, but one of the things that I liked about how he was talking about that whenever, you know, this isn't a gray area. This isn't something that you can just go, oh, well, this is pharmaceutical companies, you know, this is just over-diagnosing. No, this is people offing themselves. Like there's something wrong. And so I think that is remarkable to notice that our food changed, and whenever we were, you know, just inundated with sugar and this toxic foods, and then all of these other things changed.
You can't disagree with the stats of suicide. You can't overdiagnose that one. You know what I mean? So it is what it is. You either kill yourself or you don't. So yeah, there's no questioning that if it's that much higher and the trend is going up, something else is wrong. I mean, You can't blame it on the economy all the time either. So I get it with the corona. Corona probably has a huge spike up for it, but you know, you can't, you know, in normal times, you can't say that.
Justin,
go ahead.
I was going to say, in those statistics, did you mention attempted suicide?
No, I didn't see attempted suicide. I'd have
because
to look that up.
Because I mean, that's just taken into account people that have actually done it. I mean, there's so many people that have attempted to do it and have been saved by a passerby or family members gone in, kicked their door in and found them. So you know, it could have potentially been much higher than that.
Yeah, I think you may have gotten confused. I just said that women have a tendency to attempt more but be less successful. Whereas men, sorry, I didn't grab those statistics. Anyway, yeah, true though. It would be much higher. And then, I mean, I guess to play a little bit of devil's advocate, you know, there is the thing about the medications making people suicidal, you know, and there is the that if you give a bipolar regular depressive medication, you can actually send them into a manic state, you know. Also, if you give children, you know, it says they're right on some of the medications, giving children antibiotics can lead to an increase in suicidal thoughts and ideation, which I still understand. I get the point of that still means there's something going on, something wrong, that they're getting the medication in the first place and then committing suicide, whether or not the medication contributed. So I still think his point is valid. And but that's just another thing about the risk of changing your diet. Like, I don't know anyone, maybe you guys can correct me, or maybe someone in the comments can, but I don't know anyone that went keto and their suicide increased because they couldn't have a cupcake. You know, maybe it happens, but I haven't seen it happen. Thank you for the joke, just hit. I got it right under. But yeah, and so it's like, well, we know, especially when you're talking about teens and children,
Right.
it's like, would you much rather give a medication that may increase their issues and may increase their suicidal ideation and thoughts? Or would you rather just say no donuts, no cake, no lasagna, and put up with them screaming, crying, whatever for 3 weeks or whatever it is? You know, again, you as a parent, that's your choice. You know, I'm not, you know, going to tell you to do one way or the other. But I think most people, once they learn about this, they'll take the food over drugs. And that's what all 5 of us have done. If I remember correctly, none of us take a mood stabilizer or a nootropic medication currently.
No.
I think it's a good point to make that, you know, changing your diet is a lot safer than taking prescription drugs, right? Wasn't Zumbo, didn't you point out that, or somebody was pointing out that, you know, medical intervention was now like the 3rd leading cause of death, you know, and a lot of that has to do with, you know, just even taking prescribed medication at recommended doses oftentimes can lead to a fatal incident. So,
Well, I guess it comes down to, you know, it's convenient. It's more convenient to take a tablet than it is to cook a low carb meal. And people are like, well, and you see with diabetics, it's like, oh, well, you know, I'm still going to have my biscuit and my cake. I'll just take the tablet. You know, they're not willing to make the sacrifice and change.
Well, yeah, and one of the medications for diabetes, metformin, just what got in big trouble, or they just realized increases the cause of cancer. And there's always a new medication or something that increases risk of heart disease, cancer, or, you know, makes you pee out your butt or something like that. There's always something, leaky butthole or something. I don't know. There's always something with medications, you know, diarrhea, and it's mad.
Yeah, I want to say something. So, you know, this is quite a shame that the medical community does not accept the nutrition change, because really and honestly, there are people that have total blind faith on their doctors. I mean, you could tell them, go jump off, would do it. So that's the shameful part. How many lives could they actually change?
yeah. Type 2 diabetes is a progressive disease, so take the medication. Hopefully we'll stave off death a little longer.
And the end, I mean, you know, even those people, they end up going blind, or the last, I mean, I watched my grandmother pass away from diabetes complications. She was already blind. I mean, I think she was blind when she was like 75 or something. She was in a walker at like 70. Like, it was just like a sad state that last couple of years, especially, you know. And how much is that is the medications? How much is the diabetes? She did not take care of her diabetes. I will throw that on there. I mean, she did not, you know, eat how she was supposed to. I mean, I think she got to get it towards the end, but, you know, it's time dependent. Like, the later you wait to intervene and help yourself out, the harder it's going to be, and B, the less negative effects you're going to be able to remediate, you know? You know, carnivore is a miracle diet, but, you know, well, it needs some help along the way.
I won't name any names, but a friend of the family, retired nurse. I tried to tell her about this because she's got diabetes, and she's like, "Oh, I can't eat that." Blah 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 blah. And she's like, "Just Google it." And she Googled it, and Google told her to do what I had mentioned. And then we happened to know another nurse who was a psychiatric nurse, right? And she was complaining about all the goodies and the ice cream and everything that was available to the patients, and some of them were diabetic. And then we had another meeting, and another nurse was in there, and she's like, yeah, she's like, these patients are able to go to the pantry and take all these treats, and it's all garbage. It's all, packaged garbage food, and a lot of them, particularly people are really sick, a lot of them are homeless and stuff like that. They'll literally hoard all this sugar, and start eating it. It just makes them worse. So they're getting it at the hospital, right?
Mhm.
So, yeah. Well,
I
I thought, go ahead, Joe.
Yeah. So just recently, I bumped into someone, and we're just having a bit of a chat, and they told me that their husband is a researcher at one of the universities here, and I asked, "What's his research in?" Diabetes. So I asked the question, "What does he eat?" Oh, he eats whatever he wants: pizza, pasta. I'm thinking, but
Wow.
he's researching the causes of it. Yet I mean, if it was me, I'd be going, okay, well, all these foods cause an issue. Maybe it's best to keep away from it. But yet he's researching it and going, oh, well, I'll still eat whatever I want. Isn't it? It's bad, isn't it? It's broken.
They think that like it won't affect them, or they think that,
Oh,
yeah,
right.
There was a fundamental flaw in the approach to type 2 diabetes. One time it was kind of thought that the problem was there wasn't enough insulin. So if you don't have enough insulin, your blood sugar's too high. But they didn't really look at it from the perspective of what if you're just putting too much sugar in and you can't produce enough insulin, which is really what we see now. And of course, one of the other problems is, that even when you give somebody more insulin and more drugs to get more sugar into the cells just become more and more resistant. And that's primarily because they already have too much sugar in the cells. And then, of course, the body starts breaking down. People get these ulcers all over. They get edema and all kinds of horrible things. They go blind. And this is directly related to the metabolism, and directly that metabolism being damaged by eating excessive carbohydrates. And by excessive, we mean, well, you don't have to eat any carbohydrates. And I think that's just shocking to people that like there is no essential carbohydrate. So every time
where's
you eat it,
sugar?
yeah, you're flirting with excess every time you have it. So anyway,
And
Absolutely.
go ahead.
I would just like to touch on like, the addiction of it, of like how it's addictive, why it's addictive, the sugar and carbs. So when you're feeling bad, because people eat their feelings, we know this. When people are stressed, when people are, that's why like the joke in movies and stuff is, man, guy will break up with the girl and the girl go eats like a tub of ice cream or whatever. Or maybe the guy will too. And it's because, so our insulin response and our dopamine response are actually tied. So when you shoot up and eat, it's a pleasurable activity because we're wired to like to do the things that will keep us alive, and avoid the things that will kill us generally. The thing is that in the modern world, our level of sugar that we have access to in carbs is way, way, way above that of what we would have evolved with, you know? Whereas through evolution, our main source of calories and energy, protein would be fat and meat, animal, carnivore basically. So the brain is kind of tricked because it's like, oh yeah, all these calories, all this dopamine is shooting through because I'm happy, because I'm eating, I'm happy now. But then you get the crash. So you get the insulin spike, the dopamine spike, and then both crash. Your insulin crashes, so you get hungry because your body's like, hey, we need energy, we need food. What are we doing, And you get sad, you get even sadder because now, you know, you've got the dopamine crash. So they work in tandem. Now, when you eat carnivore, you have the dopamine go up because you're eating, because your body's happy that it's eating, because it's like, oh, we're going to stay alive. We're going to keep going. Like, this is good. You know, it was a successful hunt. But then but your insulin stays rather flat. You know, you'll have a few bumps, maybe 10, 15 points, maybe, but nothing like 300 points after a pint of ice cream. And there's a huge difference there. And so you'll get happy and your insulin's not crashing. So when your insulin comes back down slowly, your mood kind of is still stable because you're still happy. You're not crashing, you know? And then we can get into ketones. If you fast long enough and you start making ketones, then you even have a response that wards off anxiety and depression or increases dopamine by being in a state of ketosis. So then that gives you an extra shot of dopamine even by not eating, you know, which is really cool. And so that's why the food addiction, the sugar addiction is so vicious, because it's only feeding itself. You're only going to get more sad once you wake up in the morning, or more hungry and then sad because you're waking up and eating cookies. I mean, a donut is not breakfast. A frappuccino with extra caramel, double shot, whipped cream, that is not coffee. That is a milkshake. And, you know, I don't know about you guys, but I always laugh because I'll see parents with their kids or with their teenagers and be like, you know, if they said, can I have an Oreo cookie shake for breakfast? The parent would say no. But if they say, can I have a mocha frappuccino with extra caramel and whipped cream? They say yes, because it's coffee. And it's just like, no, it's the same thing. And then they send the kid to school. The kid has behavioral problems because they've just drank, you know, the sugar, the caffeine, the caramel, the dopamine, and everything. And then they get put on antidepressants or something because they're sad by math class because they don't want to listen to the lesson or whatever, you know? And it's horrible. And it's like, well, how did your morning start? You know, what did you have? You know, me as a clinician, when I hear about that, I'm like, what are you having for breakfast? What is your food? And it's always, oh, he doesn't really eat anything. He only likes cookies. So I give him cookies, you know, or, oh man, you know, I'm trying to be vegan and I'm just like, you know, I'm avoiding fats, or, you know.
What do you think would happen if they just try to get the kid to eat some bacon? How many kids do you think would just not eat bacon?
Hopefully not that many. You know, my it's weird. Like my nephew, he's kind of weird. So he had breakfast and he was cutting the fat off his bacon. And I was like, what are you doing? That's the best part. So I was like, can I eat your fat then? So he said, fine, you can take it. I was like, fine. If you're not going to eat it, I'm not going to let fat just sit there. That's the whole point of eating the bacon.
You can get
to have the fat.
Get him some center cut bacon. It's a lot leaner. But I mean, there you go. How old is that? How old's the nephew?
He's 11.
He's 11, and he'll eat lean bacon, right?
Yeah, he'll eat lean bacon.
Better than a frappuccino.
Yeah.
I mean, think about it. When we were kids, it's like get cereal. Cereal grains, I think in particular, are a big problem for people.
Cookie Crisp, Captain Crunch, Cinnamon Toast Crunch. I mean, I'm going to name names because you guys ruined my life.
And then we
probably gave me migraines. General Mills.
Low-fat milk on top of that, which has got even more sugar than regular milk.
I did that too.
We're fat deprived, and then we're just loading up with carbohydrates, right? So then we need an insulin spike to bring down that blood sugar. Then we get lethargic. Not to mention all the damage, all the excess insulin and all that glucose does over time. There, your A1C score is going up because your cells are damaged, right?
And we can't focus, and we think we're stupid. But it's not that we're stupid. It's that we can't focus because of all this chaos is going on in our bodies.
Hey, I was healthy. I was eating Raisin Bran, 2 scoops.
You
Right.
had your fiber.
You had your fiber.
I made sure I had diarrhea every afternoon. That's how healthy I was.
Beautiful.
Come on, we can't do one of these without talking about diarrhea. Our audience, I think, expects this quality content.
On that note, I just wanted to say that I have gotten in touch with Dr. Chris Palmer because I'd love to interview him and do a video, but he's too busy right now. So hopefully sometime in the future, we'll actually get Dr. Palmer on himself to talk about this.
That'd be awesome.
So, do we want to go into mental health tips?
Yeah. If you guys have any mental health tips, let's hear them.
I do. They're pointless if you are so sick.
That's a good point. Really.
What's the point? If I sit there and tell this child who is, like you said, eating donuts for breakfast and having all these other things happen to them, and then I'm like, maybe we should write in our journal and talk about our feelings. No, like that's not going to help. Or even an adult, if I'm like, well, just think about, where you are and where you want to be. And they're in such a cloud, they're in such a brain fog that they can't even function, then it's pointless. So what I love is that now I'm able to use some of those coping skills way better than I ever was before, whenever I was so just chock full of inflammation and sugar.
Yeah, I absolutely agree. I mean, doing meditations, the full body muscle relaxation. I hated meditation when I was regular, absolutely despised it. I mean, I still can't sit still, obviously, but I mean, I feel like, if I had the right music and stuff like that, like, I could probably do it, a nice walkthrough with a meditation and, journaling, thought stopping, realizing your cognitive distortions, realizing, okay, I'm angry at a 6. What do you do when you're angry at a 6? People can't, when their sugars, see, it's like stress plus sugar crash. And it's like, okay, you're supposed to use the techniques when you're in crisis or when you're frustrated, but they can't because they're sugar crashing, their dopamine is crashing, they're hungry, they're hangry, hungry and angry, and it's like they're like, I'm out of control. And
they're
I
in
can't
survival
stop.
mode.
Yeah.
They're in survival mode. So they're in that lizard brain and they're not able to have logic. You're right.
So what I'd like to say as far as a tip, I want people to realize that the gut and brain are directly connected. You have problems in the gut, it's going to show up in your brain. At least that's what I've noticed. So when my gut's better, my brain's better. So fixing what you think is in your head is not going to do any good unless you fix that gut.
Yeah, and now we've advanced from the inflammatory theory of disease to the metabolic theory of disease, where it seems that mental health issues is brain inflammation caused by possibly plants or just overuse of insulin in the body, going past the gut and causing autoimmune issues. So yeah, it's that's why the schizophrenic that Dr. Palmer was talking about going keto is able to heal. There seems to be some kind of inflammation or overactivity in the brain in certain areas for certain people, and once you've calmed down the inflammation, everything gets better. And that's why when you hear people on Carnivore, we're not just talking about, oh, my this got better. It's, here's a laundry list of things that got better, And I guess as a Carnivore tip for mental health, Emily, you're a testament to this, but I think all of us, increase your fat. I mean, we really think if you have mental health issues, like you've got to be 60, 70, 80% fat, maybe even more. I don't know, but at least 50-50. Don't try to do this whole carved out, leaned out vanity thing
Fat.
until your mental health is
Or
solid.
if you're not feeling as good as you think you should, maybe upping the fat is the way to go. So yeah, I often recommend people just start around 50-50, and then you got to kind of experiment with up or down. But certainly it seems like people will have particularly, some sort of mental problem or emotional problem, or they, or need to heal something in their brain, that having more fat seems to facilitate that.
And I know we're not big on organs here, but I do like the theory, or subscribe to the theory, of eating the organ that you're trying to heal. So, I really think if you're seriously having issues with mental health, I know it sounds gross, but maybe grab up some brain, because it's nothing but fat, in your brain,
Maybe that's
Maybe
Maybe that's a real message of the zombie apocalypse.
I love it.
that's right.
And I will say, I did actually try the brain supplement from Ancestral Supplements, and I did feel like my brain was firing on like an extra cylinder. But like it was almost too intense. I'll be honest. It's been a while since I took it, but like I felt like I was like on a nootropic, like not like speed, but like I was just too sharp. And I think it made me like almost anxious, but not anxious negative, but just like I had so many thoughts that I couldn't keep up with myself. So I think there is something there. Like if I was taking an SAT, or when I take my state exams, I'm probably going to start popping the brain supplement. Like if you have to study, don't hit the coffee, hit the brain, the brain supplements. I think it'll work, and probably better for you.
Wow.
That's awesome. That's awesome.
Well, anybody else want to take a swing before I wrap things up? Zumbo's done. Ray's done. Justin.
You could always say more. I mean, do research on cognitive distortions, negative thoughts, thought stopping. That's all very cognitive behavioral. And, just look around you. I'm a huge proponent. Read Dr. Jordan Peterson's 12 Rules for Life. It's like a bunch of therapy sessions all in one book. That book is fantastic. I recommend it to all my clients. And then, do personality testing. Take the Big 5 personality test. Get your MBTI score. That could be a fun episode. We should all do our personality tests. And then, as well as, are you an active person? Do you feel more calm? Are you a gym rat? Or are you a dark room kind of introvert, groovy music, smoke a joint? That's your relaxation. Know yourself. Have that self-knowledge, and know when you're overwhelmed and when you need to take a break, or when you need to get in overdrive. Are you being too, lazy? And sorry, one more thing. I don't like the DSM. I absolutely despise diagnosing people and diagnosis.
Yep.
I honestly believe we should chuck that book completely out. It should really only have like 1 or 2 diagnoses in it, like schizophrenia, bipolar.
What are you really? You're really trying to get my channel pulled, aren't you?
Because what I see is people having an internal or external struggle, and it's symptoms. It's either their thoughts or their feelings or their behaviors. Then they're either an asshole to themselves or an asshole to everyone around them, And it's just like, okay, how can we get this person to change wherever their thing starts? Do they feel bad? So then they take it out on the cat, and then their kids are mad because they're standing there like, stepping on the cat or something like that. Like, it's pretty sadistic. But I mean, or is it that the cat scratched them and then they yelled at the cat and then their kids are screaming and crying? There's just like a chain of events, and it's about tracking this chain and how you react to and interact with the world.
Yes.
And did you start feeling bad, or did someone tell you and you got bad news and then you felt bad and then your behavior started to change?
Cat stomping is definitely not dopaminergic.
Right. And so, you know, that's why that's the whole point of journaling, is to get your patterns. That's why they tell you to journal. But if you can pay attention and have insight to your patterns, then I believe you don't have to journal unless you like it.
Just mental journaling.
Mental journaling. Yeah.
All right. Well,
And lots of sex. Make sure you're having
yeah.
sex in committed relationships, of course. Use
Does that
protection
go?
out there.
Does that go in the journal as well?
That goes in the journal.
All right.
Absolutely.
Well, you heard it from Justin first. Eat lots of fat, have lots of sex, and journal if you can't remember your patterns. So you boiled it all down. All right. Well, if you made it this far, I'd like to thank you for watching. And perhaps you would like to leave us some comments on that note. Feel free to send all the hate mail directly to Justin because he loves the attention.
Alloutlife.carnivore. Yep.
His contact information will definitely be in the show notes. along with, in fact, he'll be first. Along with Emily. Emily's got a great group on Facebook called Center of Brilliance. I've got Autistic Carnivores and the Meat Cult and the Ketogenic Fasting Project. You can get a hold of Ray at MeatRx. He's a coach there. You can find Joe on Facebook. I'll put his links in there. I forget exactly which ones he likes to share and doesn't share, but
Australian Carnivores. Meat-based lifestyle.
That's right.
Thanks, Justin.
So all the links will be there, and please subscribe to the channel. We definitely could use the support. And until then, everybody eat some meat, feel better, and whatever you do,
Don't fall down the carb hole.